You can hear me and see me.
I can't see you yet. I can hear you. Can everyone hear? Let's have a look.
And my camera
It's because
is
there's so many of us. Let me just see.
Let me share the screen and maybe we'll.
Yeah, I think you'll come up. And as you, there we are. There she is. Elisabeth, thank you so much.
Yes.
Let me just introduce you. So, Elisabeth is doing our Building Trust with Underserved community session. She's a public health professional with over 15 years experience leading community-focused programs that address health inequalities. She's currently program lead for sexual health services at the BHA for Equality, and she oversees the HIV and STI prevention, women's health initiatives, and culturally sensitive outreach across Greater Manchester and Liverpool. And we've had the great pleasure of working together recently, and I just say she's amazing. Her team is amazing. Thank you for sharing your time today. And I'm going to hand over to you now.
First, I'll ask if everyone is seeing my screen. You can see the PowerPoint, yes? Yes. Hi, everyone. Thank you for inviting Ruth. Very happy to be here. So my name is Elisabeth. As Ruth already explained, I'm the sexual health lead, so a program lead for sexual health service at BHA for Equality. And today I want to talk about building trust with communities whose voices are often unheard, and about the BHA approach of community-led and person-centered. So just to give a bit of context, BHA for Equality works to reduce health inequalities and empower people from racial minoritized communities, migrant, LGBT, and other underserved communities. And we work across Greater Manchester, Liverpool, Leeds, Wakefield, and Coventry. We have projects in sexual health, but also in TB, cancer, diabetes, and other conditions that affect more vulnerable communities. So I lead a sexual health team. So I lead the sexual health service that provide HIV and STI testing, distribution of condoms, information and advice, group session, training, and creation of resources in different languages. Our sexual health team spends every day in direct contact with people, experience multi-layers of vulnerability, such as immigration status, poverty, racism, stigma, digital exclusion, so many. During our interventions, we hear stories that reveal not just what is happening, but why it's happening, and that trust is built through relationships and sharing spaces with the community and listen to them as well. So I brought here the stop. Why is trust missing and what else matters? I brought here some data in terms of sexual and reproductive health inequalities. And the data show us that health inequalities exist and have some, like a healthy life expectancy for people in most deprived communities, 18 years lower than for least deprived. And then this is also mirrored in the sexual and reproductive health outcomes. That shows, for example, like Black Caribbean are disproportionately affected with rates twice higher than white ethnic groups, that 52% of Black African were diagnosed late, and maternal death rates remain unacceptable or higher among Black women. And just this is some data, but these figures are not the result of just individual behavior, but also reflect systemic disadvantage. And when people carry trauma or shame or previous negative experience, trust becomes the first barrier to access services. So I brought here some real codes, so from our work when we are in the community or from some focus groups that we deliver. So I'll actually going to read some of the codes. The first one was from an asylum seeker like around 2 years ago. So if you are an asylum seeker like me, the only thing you think about is what is in the news. The Home Office is putting people in detention centers and sending them to Rwanda. So this is my problem now. I don't go look for an HIV test. If I feel sick, then I'll say. So that demonstrates the priorities, that sometimes we are prioritizing so much in terms of your health, but they have like kind of different priorities. Another sentence from someone that was talking about how she was feeling treated by a receptionist in a health center. Sometimes they differentiate on the basis of our skin color, race, gender. When they see us, they feel like this person is from a minority. We don't need to worry. They don't know about their rights. And then the last sentence is about a mom, working mom. The sexual health clinic is just too far from me. The bus costs too much. And even if I could go, who would pick the children from school? So when we ask why people don't engage, here are the recurring barriers we hear everywhere. So it's like medical mistrust, past experience, fear, and shame, language barriers, health illiteracy, community and social and personal stigma, discrimination, bias, racism, digital exclusion, lack of cultural relevant information or competency, lack of confidence, self-esteem, and other social determinants of health, meaning that sexual health is not a priority. So this sentence that I just disclosed, that I read for you, illustrate these barriers. People are not just disengaged or hard to reach, as reported are unheard. So our second starts, I brought like building trust, reshaping service by sharing a bit of the BHA approach. So BHA, instead of asking communities to fit into service, we shape service around their lives and experiences. So our approach is community-led and holistic. So we listen to the community wants and design the service around their lived experiences. We also, and very important, we listen without assumptions as well. And we use a holistic approach to sexual health. We go beyond just the testing. It's not just about how many people we test, but we understand that sexual health links to mental, physical, emotional, social well-being. So our sessions are usually about consent, about healthy relations, communications, with other providers, understanding body and symptoms, and also inside of BHA, we try to work not just with the main service user, but also other organizations that support the communities or sexual health clinics, GPs, to kind of have like this holistic approach. So still in the start, building trust in receiving service, I'll just we'll share some strategies, community engagement strategies of BHA. So I have here like illustration of some of the activities as well. So culturally tailored outreach. So basically it's creating a space for open dialogue where views may be restrictive or challenging in supporting learning respectful in community-led way. So basically we create our sessions, and sometimes we go to the community. We have like here illustration or picture of some sessions that we deliver sometimes in ESOL classes. but also like in barbershops, like we're very flexible. We kind of try to go where the communities are. So we do partner with different organizations, and that is, for example, like community hubs, is all classes, like I said, festivals, so different different stakeholders to reach these communities. Equitable access, so providing equitable access to HIV, STI screening, and condoms and lube, PrEP. Just to give an example, for example, we have like the click and collect for HIV tests. And then that's the reason came because some of the communities, mainly, for example, refugees and asylum seekers, they don't have a fixed address. So it's important, like that's the reason. Then we designed like the click and collect. So this kind of strategy that we use by listening the community and then reshaping the service. We deliver also group sessions, trainings, workshops, and seminars. And this because, you know, always information is power. If the community are more informed, they'll have better decisions. We develop resources in different languages. Very important to say, like, we're trying here to bridge language and communication gaps. It's not just about translation, but it's also including cultural and social meaning. So when we develop our resources, we always do, we co-design with the community. You ask what they want to be included in the resources. Like, for example, we have here like some examples, your guide to contraception, your guide to STIs, menopause, we have several. So we try always to involve the community to design the resources. And again, like I was saying, that's so important, person-centered and holistic well-being, recognizing the alternative approach to well-being of these communities. So for the still, I brought here the use of social media influencers. So as you can see, we have like different approaches to engage the community. One of them is the use of social media influencers. So I'm just going to share like how we work with the social media influencers. So they basically like trusted community leaders and influencers like that, and then it can be like barbershop, beauty professionals, local advocates. So the people that are recognized the community, usually they like when we choose them, they usually have like a number of followers, but they are recognized in the community. And we specifically try to use social media influencers because they have like a different way of communicating with the community. They have like the trust that we are talking about already, and they use also a different language to engage with the clients, like that. For example, if it was BHA for equality, maybe we'll use a different type of language. I have here, like, for example, two different posts of community ambassadors, and have, like, for example, here one saying like, I support HIV prevention, and HIV prevention, it's an elephant in the room in our communities, and we need to talk. So they talk like direct to the person, and for this is very effective. So in terms of the strategy, we develop, when we use social media influencers, we develop a sexual health campaign. And then after that, we define what the asks for the social media influencer. And then we find the sexual health influencer. So when I put here the sexual health influencer needs to be, of course, there's some criteria that important, like if they are aligned with the BHA values. For example, we do check the profile of the person. Imagine if to check if the person, there's no homophobics or misogynics or racist comments in the profile of the person. So to double check if the person aligned with BHA values, the number of people that follow them. And then we invite them, of course, to be part of the campaign. And then we deliver also, we share the assets, but we deliver training as well. Training about HIV, sexual health in general, of course, and about the campaign itself. Depends, imagine, it could be like Sexual Health Week or HIV Prevention Week. And this training is because sometimes people do ask, although they say, for my information, to contact BHA, sometimes people contact them directly more information about, for example, how to order an STI kit. So we give this training to the influencers. And then we, of course, after the campaign, we do always the evaluation, how it works, how the impact also that these social media influencer has. And it's great to see like the conversation actually that they have in the chat about HIV prevention, like, oh yes, I need to go to test. Where can I test? So it's actually a very good way of engaging with the communities, and they have their own network as well. That is important, like actually to mention, because sometimes when we have like where organizations sometimes have the network of organizations, sometimes the other organizations, but the influencer actually have contact with the community. So I try to be as short as I could be. But for more information, please, you have here my email. And I'm open for any questions.
Thank you so much. Yeah, you did catch up. I appreciate it. That's so interesting how you manage your influencers and you even give them training. So I wonder, yeah, I didn't realize they had actual training as well. And that's really, I suppose that shifts them into the role of ambassador a bit more than trainer a little bit.
Is exactly. Actually, we have like I just gave the example of the social media influencers, just because well, in terms of time, one thing to steal.
Yes, yeah.
But also have like ambassadors, kind of like because some of the communities are digitally excluded, so we have like the same strategy in terms of the ambassadors, people in the community delivering this information
Yeah.
as well. And it's always important to give training because we want them to give to the communities accurate information. So yeah, it's important. It's part of the kind of a contract that we do, the agreement that they attend to training.
Thank you. And Charlotte's picked up on that as well. She's got a question. Charlotte Crowley. Do you want me to read it out, Charlotte, or do you want to come on and ask Elisabeth? Since we're in a different format, you're very welcome. I'd have to find you, I
I can
guess.
see here like the training and about we have celebs, but getting them to reply. So we don't recruit celebrity like in the sense of what we think about celebrities. Sometimes they don't have that many followers like well, like you may think. So sometimes they don't have that many followers, but they have a very good reach in our communities. So it is not like the celebrities, but they are very well known in the community. So that is the difference because the ones that they're disposed like conversations about sexual health, and sexual health is a subject is very intimate, there's a lot of stigma, shame around it. So the conversations with a person that is, for example, the barber shop that has a lot of influencer or they have a lot of followers, imagine this person has more impact than for the person actually to go to test for HIV than a celebrity like, the movie star from the Hollywood. So this is the people and these ones are more open to training than the celebrities will have. So, and the training also is also short. It's not like complicated. It's not like an intense training, but some key messages.
And Charlotte, do you want to write in the chat who your celebs are? what it is that you're working on. That'd be really interesting because I think it is important. And Alison is, yeah, someone just said picked up on it is important. Sorry, Ivy. Ivy said the difference between influencers and influencers. Yeah, it's so important, isn't it? And that's the whole point of inclusion, isn't it? It's not always your councillor, the local MP, or your director of public health, even. It's who matters to your community. Yeah, that's brilliant. And Gillian says, I've been thinking about targeting barbershops for a new campaign. Any tips? Any tips for Gillian, Elisabeth?
Yeah, so it works with us. Barbershop is actually working, but it's kind of first we build a relationship. I feel like it's not just we just go and ask, do you want to be a social media influencer? Or it's kind of all the barbershops and the places that we work in terms of developing campaigns. We had like a previous relationship. So, for example, we go to the barbershops and we talk with them. We explain the situation. We talk with the clients. We deliver testing there in the barbershop. And then when the relation of trust and the understanding of the need is there, then it's when we ask, for example, to be a community ambassador. It's not just like another thing. It's paid. Just one thing I think is important I didn't mention. So we do pay the community ambassadors and the social media influencers, but because we respect and we value their time, sometimes people even are okay to do it for free. But I think it's important for people to feel valued, and they are giving their time. So not just asking without giving anything in return.
Thank you. That's such an important point. And yeah, lots of lovely chats going in about people working with community leaders and things. So do hop into the chat, Elisabeth, if you like. Thank you so much. We are back on time. Elisabeth, will you be around in the chat if people have got questions for you, and pop your LinkedIn and connect with you? But it's so amazing because you're in building deep trust and long-term relationships. So, because these things are never just one off, are they? It's not like, oh, I just signpost somebody and then they suddenly go. Do they have to pay for their own training, or do you offer, is that part of the gig?
I would just would like to respond at least one of the question in terms of how much we pay. Is very different person campaign per campaign. We know third sector do struggle with getting to how to get funding to pay these kind of things. But sometimes we even pay from 20 to 200. It depends. Sometimes people just want to actually feel like we are valuing their time. It's not about the money itself. So, and sometimes we do pay like is more like an amount. It's so reasonable that is not even like a payment. It's just a recognition almost. But it's important to do it. So around, some people even offer their service. So like when the trust is built, not straight away, but when the trust is built, some people say like, would like to do something for BHA. It's possible.
Okay.
So it depends the money.
Just a really quick question. How do you build the trust?
Time and explaining people the reasons why. People need to understand why, the reasons behind, and how it's going to benefit them. People don't like to feel like they're almost like used when they need, and then we forget. It's good to come back and explain them again, like the outcomes of the approach. Otherwise, people feel like they use me, like, and then they don't talk with you again. It's a relation that's built, but it needs to be maintained. And we need to listen, like I said, again, we need to listen and respect what people have to say to us, not just arrive with approach like, oh, I already know your needs, and not listening to what people have to say.
Thank you so much, so much. Thank you. Really appreciate you coming on, taking the time. Please, everyone, do connect with Elisabete's work. It's incredible. Thank you so much. We will pass on now to Katie, if that's okay. Katie, it's like Eurovision time again, calling Katie.